gosh, sorry. Help me.
Preventive.
How does that?
Preventive.
I was trying to, in my mind, it's just like preventive help, and I don't know how to say it. I'm so sorry.
Not easy. No. You're doing very well. You're doing very well. Hello. Not easy.
Welcome to another episode of NUHS Care to Talk.
Hey, I want to ask you guys something. Have you guys gone for your health screening recently?
Actually, I have, just last month, I think, we have some staff benefits, so I took full advantage of that. Went for my health screening, did the usual blood pressure, cholesterol, did some scans here and there. Not too bad, I think, my results. But what about you? Did you?
I'm asking from a place of guilt, right? Because actually I haven't been for a health screening for super long. But today we have Prof. Jimmy with us from the Department of Surgery from NUH and NCIS. Prof. Jimmy, tell us a bit about yourself and health screening.
Thank you for having me. My name is Jimmy So. I'm a senior consultant surgeon at NUH and also NCIS. So health screening, I think, is very helpful, especially for persons who are older than 50 and above. And they're highly recommended for this group of populations. And usually it's a standard health screening, blood pressure, blood sugar, and blood cholesterol. These are the essential components of health screening.
It's quite interesting. A lot of people lead healthy lifestyles, no family history, but then suddenly can just get diagnosed with cancer. How does that happen?
Because cancer starts from small and then they grow and subsequently spread to other organs. Therefore, in the early part of the progression or the journey of the cancer growth, many of the time they have no symptom.
Yeah.
And this is part that have the best chance of cure. Not easy to detect this part. Therefore, cancer screening may be able to detect this portion. Because by the time they have a symptom, for example, bleeding or blockage, most of the time that the tumor is in the high stage of the cancer. And also with that, the treatment outcomes are less satisfactory.
Right. I'm sure throughout your career, you've come across a lot of patients, or not say a lot, but a few patients who refuse to go for screening, and then in the end they come with late stage cancer. What are some of the reasons that they give you for saying like they don't want to go for screening?
And I think two major reasons. One is fearful of the diagnosis or fearful of treatment. And because many of people, they still have the fear of surgery, for example, or chemotherapy, and they run away from the treatment. But actually nowadays, because there's many technical improvement, both in surgery and also in the chemotherapy, the risk and the side effect of this treatment are much, much less. And second group of people are people who have financial concern about finance, because and they always worry about the cost of treatment in Singapore. And because of these two reasons, and some people run away from cancer screening and cancer treatment.
Sounds like the moral of the story is you cannot run away from your problems.
Yes.
Right.
How would you encourage these groups of people, Prof?
First of all, cancer is not a death penalty and death sentence.
A lot of health screenings, they do ask you, hey, you want to add on this, like test for cancer markers and all that. I would imagine that's something quite key and quite important.
I think this is a very common misconception. Unfortunately, most of the current tumor markers are actually not accurate for diagnosis or cancer early detection. They use it for monitoring of the response or to predict the high risk versus low risk of cancer. Not so much for cancer detection.
What are some of the other common cancers that the general population need to look out for?
Common cancer like colorectal cancer, the recommended screening tests are using stool or occult blood. And for lung cancer, and especially for people with high risk of develop lung cancer, the recommended screening is actually a CT scan of the lung. Therefore, I think those I mentioned are specific cancer detection method. Depends on the individual's risk profile. Each one have their own guideline. For example, lung cancer, they recommended for using a CT scan. Usually are for people who really have a high risk of develop a lung cancer, such as people who are heavy smoker. And these are recommended method for doing what you call low dose CT scan. to detect early lung cancer. And people without this kind of risk, for example, you are not a smoker or no family history of lung cancer, then it may not be necessary to carry out this kind of a screening test.
If someone is afraid of going for all these scans or endoscopies or whatnot, what is something that new that has kind of been developed recently?
Something new is many of us are trying to develop a blood test because a blood test is convenient and is less invasive and much more comfortable for our patients. But you can understand that in order to detect blood markers in an early stage cancer is not easy. Whatever chemical detected should be a very, very small trace in amount. Therefore, you need a very sensitive method. Recently, many of our group have developed a panel using a panel of microRNA. MicroRNA is a small genetic material in the blood, and they reflect the changes of the cell biology very accurately. And also, they are very stable in the blood. Therefore, it allows us to easily detect it in the usual laboratory. And not only in this technology, we are not measuring one marker. We're using a panel of a marker, and that will improve the sensitivity of this blood test. And currently, this is available for both for stomach cancer detection and also for lung cancer detection. And we hope that this will help to have an early detection of these cancers.
So let me get this straight, right? You're just saying that all I need to do is do a blood test, and then I can detect whether there's a potential for stomach cancer?
Yeah.
It's still in the clinical trial setting, and based on the early experience, these are sensitive markers. Although the gold standard are still using an endoscopy for gastric cancer and also CT scan for lung cancer. But for people who are fearful of these tests, they find it too inconvenient for them. This is blood test using this microRNA is certainly one option. Or for people, the risks are low and they still want to exclude these two cancers, then a blood test is maybe an option for them.
And so far, it's only used for, you were saying, stomach cancer and lung cancer, right? What about the other? Is it in the work?
We are in the pipeline. We have other common cancer. We want to have early detections. And right now, Singapore is leading an ongoing project to develop a blood marker can detect the most common cancers in Singapore.
And you talk about most common cancers. You read the news, you hear stories from friends. A lot of people are also getting cancer much younger. I am not sure if that's a trend that's just, unfortunately, people I know. Is it something that you also see in the hospital?
This phenomenon is called young onset cancer and being increasingly recognized, not only in Singapore, but many of the different parts of the world. Most of them are related to either the family history or their lifestyle. Therefore, for people who have no family history and have a healthy lifestyle, the risk of a cancer for a young person still actually remain much lower compared to an older person.
How important is it for people to actually go for these tests if they, like you say, they recognize they've got a bit of family history, they realize, their lifestyle contributes to the potential of having either lung or stomach cancer? How important is it for them to go for early screening and why?
Early detection is a very important strategy to improve the outcome because if you detect the cancer early, most of the time you can get a curative treatment and free of cancers. And the treatment also is much less invasive.
Is there a percentage as to like how, if you detect your cancer early at an earlier stage as compared to a later stage, what's the
Success rate?
percentage of survival?
This is a very important factor for the cancer treatment. And the outcome is completely different from stage 1 versus stage 4, advanced stage. Most cancer, if you pick up in stage 1, they have very good chance of survive. The patient will survive and get a cure, up to 80-90% or even more. On the contrary, if you pick up in the stage 4 cancers, the treatment outcomes are much worse. And thankfully now with chemotherapy have improved, but certainly much, much worse compared to stage 1 cancers.
Okay, what are some success stories that you remember that really struck you?
We have one patient that I think is from primary care, and for some reason the patient went for the blood test instead of endoscopy, and surprisingly the patient have a high level of gastroclear.
How old was this patient actually?
I think it's about middle age, 50s.
got it.
Yeah, in the
So,
50s. Therefore, she went for endoscopy and to her surprise, it really confirmed there's a cancer, even though the patient have no symptoms. And when the patient went for successful surgery, and then now it is cured.
So, Prof, GastroClear is available to the community through like just visiting the GPs. You don't have to go to the hospital. How does that, fit into the national push for preventive health?
This is part of the preventive measure because GastroClear or lung clear, this is a blood test and able to detect cancer early. And because it's a blood test, it's very convenient, can be easily conducted in the polyclinic or in the family medicine clinic. And we hope that this will be easily accessible for the patient, readily available, and very convenient as a part of health screening.
When you created, when you led this project, right, what were some of your considerations, into making cancer screening more accessible?
I think blood test is always a very popular method for health screening because it's the ease and the convenience of it. And we hope that this test can detect the cancer accurately, and we don't want to miss any cancer. This is the sensitivity have to be high because we don't want to give a false reassurance for patients when they have a negative test, but they have in fact cancer in their body. We want that this test can able to detect early cancer, not just the late stage cancer, because you pick up only the late stage cancer, you also doesn't make an impact to our patient. So these are the two factors we really want to construct.
So I think it's important, right, that it's accessible for the community and that not just GastroClear and lung clear, but hopefully other tests in the future also will become more accessible for the masses. And there's always that stigma where if you want to go to the hospital, you don't really want to because you want to try to avoid
The waiting times.
And not many people like to come to the hospital.
Sure.
Right.
Yeah.
So I think it's good that we have more of these tests, more of these screenings out, and it's much more accessible. Any last words, Prof. Jimmy?
Health screening is useful because many of these diseases, they have no symptom in the beginning, and health screening can able to detect those. And then with this, you detect it early, then certainly your health outcome are much, much better.
All right. Thank you, Prof. Jimmy. And we'll catch you on the next episode of NUHS Care to Talk.
See you.
Thank you.